Good evening, everyone. My name is Courtney Prudham, and I am the owner and executive leader of the Community Christian Dual Diagnosis Residential Counseling Center. The primary objective of this meeting is to discuss business planning as curated by the team with the input of stakeholders, which includes our consumers and family members. The agenda of this meeting will cover organizational goals, the importance of collections, accounts receivable, and cash flow balances. Our organization operation plan is a collaborative plan with an emphasis on promoting Christ at the center, as well as our clients. The mission is to increase consumer treatment commitment and assist people with co-occurring disorders towards recovery. Our organizational goals and objectives are as follows. Prioritize client-centered care and collaboration with Christ at the center of all things. Communicating using joint information systems. Providing timely services, including the new brief Christian psychoeducation interventions that we're implementing. Support services and social connectedness with the community. Limiting the impact of the crisis on community psychological well-being. Improving collaboration with our managed care systems to ensure outpatient services are covered, as well as our residential and detox services, to adequately meet the consumer's needed and necessary length of stay and the treatment modalities that we are providing. And the next objective or goal is to have timely submission of state joint commission required documentation for adequate and appropriate reimbursement from our managed care third-party payers, primarily the insurance companies, as well as family payers. Let's discuss planning. Overall, we need to discuss strategies for reducing the time spent making phone calls, having denials and appeals, trying to reverse these denials, and so on, without damaging the relationship that we have built with our utilization review department and our payers. We need to discuss the partnerships that we have with them. It's important to discuss this list of mutual and aid agreements that we've made. This will be sent to your emails with all the necessary contact information. Just a reminder that we do have contractual agreements with the Texas Joint Commission. They do random audits to ensure compliance with state requirements or the operation of our addiction treatment center, our co-occurring disorder treatment center. We also have these contracts with HMO providers, MCO payers. In accordance with licensure and organizational policies, we have provided a reoccurring annual mandatory training with our utilization review. The first training that we're going to have is going to be at the end of this week. We're going to discuss their requirements to reduce these insurance denials. And we need to understand what necessary components are needed in our documentation to justify medical necessity for treatment. We will conduct this meeting with our partners to reinforce clarity of any business plans. So I do want you all to develop a list of questions that you need to ask the utilization reviewers to ensure that you are documenting adequately so that we can ensure patient safety and that their treatment stay is covered and that there is a medical necessity for them to be here. Now let's discuss the client safety. Although we have contractual agreements with managed care systems, it's important to ensure that client safety within our record keeping and communication is up to par. We must not forget that their confidentiality is also a priority when we're having these meetings. Another important component to client safety, I must emphasize, is the financial component. I need to stress this. Clients themselves are not responsible for providing their need for treatment services. They don't provide that justification. We are liable advocates for providing those accurate claims. Let's discuss accounts receivable first. Let's start there. because the money that consumers pay significantly impacts the company. We accept all major insurance and cash pay. A lot of them are out of network, so we have higher premiums for our care. This is the money owed to us, to our business, for the services that we are delivering that may not be automatically accessible to use. Regardless, we are billing for daily deliverable services, which includes group therapy, individual therapy, psychiatric visits, medication management, detoxification, and residential stay at our facility. Every team plays a vital role in the generation of revenue here. These assets can be turned into losses if we are not diligent in our documentation and timeliness and turnover of our clientele. A major component of this business plan is reducing the number of unsuccessful discharges, whether it be against medical advice, AMA, or administratively. Maintaining a high census is the goal for our continued revenue. This means the following objectives needs to be considered: quality of care, daily check-ins with our clientele, support from all teams on board to the client, following appropriate protocols as it relates to due diligence. Although we are discussing finances, this does not discredit the importance of ethics in our provision of care. We have an ethical duty to protect our clientele from harm, foster client autonomy in their treatment, working for the greater good of others, providing equitable treatment that meets each consumer's needs, maintaining professionalism, and leading with integrity. Please be sure to complete your annual ethics training before the end of this week. You all have been doing a great job adhering to our code of conduct and providing excellent care to our clients. This meeting is not to single anyone out, but to have shared leadership. I do not believe in a top-down bureaucratic system approach to leading this organization. We will be implementing a new service which was agreed upon by the team, the clients, the community, and other investors, which includes brief Christian psychoeducation group interventions. These services will be provided as a form of psychological first aid, safety. These interventions will be accessible in person, on live stream, and via telephone, dial-in conference calls for family members, so that they can participate in group sessions provided once a week. Family reunification will be prioritized in our deliverable services. This will help generate more income as well. Family therapy is a billable and vital service to clients' recovery. So we want to ensure that we are promoting the accessibility of this service to clients and to their families. Now let's discuss a bit of mitigation in this plan. Mitigation involves risk reduction. We have partnered with local cybersecurity agencies to enhance protections to ensure that when and or if an attack occurs, when utilizing these technological advancements and virtual services, that its impact can be contained. And if we are targeted, we can recover quickly with the use of new technological advancements we are bringing on board to our team. The next agenda is collections. Our quarterly goal is to obtain at least $3,600,000 in revenue. This totals about $14,400,000 annually. To assess our progress towards our collections, the goal of our accountants are tracking payments. We need to ensure that all payment plans are up to date and send any failure to pay notices by the end of this week. We want to make sure that we do not have any outstanding accounts receivable balances. Payment plan installments are granted on a contingency for up to 4 weeks allotment pay. This timely collection of accounts receivable collections are all interplay with cash flow. To summarize, this business plan focused on Christ, communication, collaboration, clinical assessment, and connectedness with the clients at the center of all treatment decisions. Our organization has made investments and established partnerships to promote safety and security that align with our organization's values and missions. This operational business plan intends to emphasize accounts receivable, collections, and cash flow, practical guidelines, and the necessary protocols. Our intent is to minimize being reactive and minimize financial losses, to make the most out of our time and our resources, being diligent and providing adequate care. Now, I will open up the floor for any questions.